So Boris Johnson has announced sweeping changes to the lockdown in England. From Saturday the 4th of July, you can have dinner out, have a drink in a pub, go on a staycation, get your hair cut, with safety precautions in place. A 1 metre plus rule will replace the previous requirement that people keep at least 2 metres distance between each other, and 2 households of any size can meet up inside or out. Pubs and restaurants, cinemas, museums and hotels can all reopen, providing they've made changes to reduce the possible spread of COVID-19. But other riskier venues like nightclubs, soft play centres and beauty salons will remain closed for now. The changes for the hospitality industry won't be introduced so soon in Scotland and Wales. And the government's chief scientist was keen to warn that the virus has not gone away, describing this as a long haul. Our political editor, Gary Gibbon, reports.
We can say that our long national hibernation is beginning to come to an end, and life is returning to our streets and to our shops. The bustle is starting to come back, and a new but cautious optimism is palpable.
It'll be some time before the paint wears off the 2 metre warnings, and the government wants you to observe them where you can. But there's a new slogan born today.
1 metre plus, meaning they should remain 1 metre apart while taking mitigations to reduce the risk of transmission.
That means businesses can waive the 2 metre rule if they take special measures to reduce the chances of infection, which in some settings might mean face masks, perspex screens, for many restaurants, reducing the number of tables.
You're going to have some tables in here spaced out.
We have to,
yeah,
as quick as possible. I mean, we're certainly losing seats. Yeah.
Will you make money that way?
Well, this is a very good question, because I mean,
my main worry is
you
in
don't
winter.
know. You can't really predict actually what is happening.
Biele and Reinhard Weiss run 3 German-themed restaurants, this one at Kingston upon Thames. The 2 metre rule made business impossible for them and many others. Today's changes give a sector which shed 500,000 jobs this year a chance of holding on.
The challenge now is how can we staunch the flow? So I think we are going to see a contraction of the industry. We will lose some businesses. Our hope is that we can keep job losses just at that 500,000 mark.
Opening for business alongside pubs and restaurants, much of the tourism industry, like Bosworth Water Park. From 4th July, it can open up its campsite and log cabins, though guidelines are expected to lay down strict cleaning rules for common facilities and for self-catering.
I don't think we're going to be able to work at 100% occupancy, but I'd like to think we can get to about 75%. For the tourism sector, though, this year isn't about making a profit, and it's about fighting to survival to get through to a profit next year.
But still in hibernation, some businesses, the government says, it's still not safe to open.
Close proximity venues, such as nightclubs, soft play areas, indoor gyms, swimming pools and spas will, I'm afraid, need to remain closed for now.
Venues like restaurants that do open are being asked to take customers' names and contact details so they can be traced if there's an outbreak linked to the site.
I came back from Munich. The beer gardens, they are policed, they are controlled. Interesting. Everybody has to fill out a form, with the address and telephone number and its name on it. For contact tracing, I found this quite impressive.
Would you be okay operating that here?
Absolutely no problem.
Yeah.
I mean,
but we will do it online.
What about your customers? Would they be okay?
I think they. I have a feeling
with data.
People are amazingly adaptable to this sort of situation.
Indoor meetings between one household and another will be permitted, and with both sets of grandparents if you see them separately. The Prime Minister spelt out at what Downing Street said would be the last daily Number 10 press conference.
We will be asking them to follow guidance on limiting their social contact rather than forcing them to do so through legislation. And this obviously requires everyone to act responsibly, which I have no doubt they will do.
Are these changes following the science or economic necessity? The Chief Medical Officer warned easing restrictions might mean more COVID infections and deaths.
If people hear a distorted version of what's being said that says this is all fine now, it's gone away, and start behaving in ways that they normally would have before this virus happened, yes, we will get an uptick, for sure. It is not risk-free, absolutely not risk-free. Nobody thinks it is. And we may, at some point, say that particular bit of the decisions that were taken is too much of a risk with the benefit of hindsight, and we have to go back on it.
The Prime Minister insisted talk of different measures in different parts of the UK was exaggerated. But even as he spoke, the Scottish Government was saying it hoped to open all schools to all pupils in Scotland from the middle of August. It draws attention to a complaint MPs on all sides make. Number 10 has managed to get licensed premises in England open some 2 months before all classrooms.
And as for July the 4th, well, I hope it will be a great day. But obviously, people have got to make sure they don't overdo it. And we can't have great sort of. I know that Chris is particularly worried about this. We can't have great sort of writhing scenes in the beer gardens when the virus could be passed on. This has got to be done in a sensible way.
And with that, 12 weeks of daily press conferences ended. Policy has shifted decisively, and the government hopes an economic disaster may have been averted.
Our health and social care editor Victoria MacDonald joins us now from the newsroom. Victoria.
Yes, well, we heard there Professor Chris Whitty, the Chief Medical Officer, talking about distorted versions of the messaging. And what this comes back down to is that tension between the politics and the science. There is a need, the Prime Minister has told us emphatically, to get the economy up and running. And yet the fact is there is still a lot of infection in the community. It's the epidemic, Sir Patrick Vallance, the Chief Scientific Advisor, said is coming down slowly, but only between 2 and 4% a day. What's more, only 5% of us have appeared to have antibodies to the virus, so most of us are susceptible to it. We heard there again Chris Whitty talking about this not being risk-free. He said the advice is to stay at 2 metres, but if you can't do that, then of course for 1 metre, but mitigate that risk. Wearing face masks, well, that is quite a confusing message. Is it 1 metre? Is it 2?
Well, let's talk now to Professor Sian Griffiths. She chaired the Hong Kong government's inquiry into SARS and is a member of the Advisory Board of Public Health England. She joins us from Oxford. Can we just ask you, Professor Griffiths, do you feel comfortable with the idea of lifting restrictions, given there are still thousands of infections and not a few deaths?
This is a time for caution, but we have to start lifting the restrictions at some point of time. If you listen to the press conference, throughout the press conference, there was an underlying note of this is about balancing politics and health. This is about the economy and the benefits of opening up the economy, as well as the risks to health. And this is a risky business. However, having said that, there was also an emphasis on the fact that we need to think not that the 2 metre rule is gone, but the 2 metre rule is there, except that it's not a rule anymore. It's advice. If we can stay to 2 metres, that's good. If not, we should mitigate at 1 metre. And so I think that this is a step in the right direction. Many businesses, many business people, many parts of the country need to open up, need to start to open up, but at the same time, they need to stay vigilant. And I think that's a really important message. This is not about everything returning to normal. This is actually about, this is a step in the right direction. As long as things go okay, we can continue to relax. But if things don't go okay, we will be back into lockdown.
Strange that you can go to the cinema but not to the theatre.
Well, being someone who likes the theatre, I'm not quite sure what the science there is, and I'm sure that the theatre. I think you will be able to go to the theatre soon. You can't go to live performances in the theatre, and it could be something to do with what happens on stage, or people projecting from the stage into the audience. It could well be something about that, but I do hope we see the theatres opening soon, because again, that's a whole other sector of our economy which has really suffered very badly during lockdown.
But don't you think this is actually rather confusing? I mean, why doesn't the government, for example, do you think, give really clear advice sector by sector? So, for example, if you're fit and over 70, X, Y, Z. If you're any age and suffer chest infections, A, B, C. If you're a mother with young children, well, people need to know exactly why are they fit. And surely with the internet and everything else, it would be possible for the government to put out very, very clear signals to each sector of society.
I think we need a continuing dialogue here, because there is a confusion. There's always a confusion when a new piece of guidance comes in. We have to absorb it and see some change in our, and how we all behave within it. I admit it's not entirely straightforward. It's quite difficult to remember between the different rules about the bubbles. And in a way, we have to really rely on each of us assessing what we know, assessing how it fits our lives, and reducing the risk as much as possible. Because, for example, we may choose...
Sorry to interrupt, but we're a bit pressed for time. Can I just ask you about Germany and South Korea very briefly? They've had really good records of dealing with COVID, and yet here they are having to impose new shutdowns.
Well, that's because the virus hasn't disappeared from anywhere in any country. And both South Korea and Germany have relied on test and trace as a means of controlling the disease throughout. And what they've done when they've seen these outbreaks is they're quite clustered outbreaks. They've then thrown the cordon around that particular area, brought in isolation, quarantine, and hoped to suppress the disease. In Beijing last week, there was an epidemic in the market, starting in the market. There was very quick reaction, locking down the local environment, contact tracing, looking at people who've been in contact with the market, lots of testing. And the news this week is that the numbers are going down.
Professor Sian Griffiths, thank you very much indeed for joining us. Thank you.
Well, the president of the Royal College of Physicians and the chair of the Royal College of Nursing are among several senior health leaders calling tonight for an urgent review of how the UK should prepare for a possible second wave of COVID-19. Dr. Fiona Godley, editor-in-chief of the British Medical Journal, is one of them and joins me now from Cambridge. Good evening. What sorts of lessons do we still need to learn?
Well, I think it's hard to say that the UK has done well through this pandemic, but this call for a rapid forward-looking review is really intended to be no blame. It's intended to be cross-party, across the Houses of Parliament and across the four nations, to really try to learn where there have been weaknesses in our response and what we can do differently to make sure that there isn't a further great deal of loss of life in the event of a second wave of COVID.
But in the government's terms, the NHS wasn't overwhelmed. Many intensive care units still had beds for people. So what is it you feel that needs to change? Because any peak isn't looking like it's going to be as big as the one we've already had yet, is it?
Well, I think that's very hard to tell. But I think first about the NHS, I don't think it's fair to say the NHS wasn't overwhelmed. I think it responded magnificently, but it's only been able to cope by stopping doing everything else. We now have a huge challenge of getting the NHS back on its feet. But this call that we're making is not really about that. It's looking at a number of issues where frontline workers are really struggling and seeing that things haven't really worked well. And the issues that have been identified initially, obviously if this takes place, the people running it will have to work out the scope. But the issues that we've identified have been around governance, around the links between local and central government, about the problems of unresolved issues around devolution. There's the fragmentation between health and social care and the lack of coordination between existing structures, which I think we've seen in the testing and in other parts of the response. There's procurement of goods and services. We've seen repeated, real failings there that have cost lives and caused a huge amount of lost public trust. And then there's this disproportionate burden on the community. And finally, just lack of international coordination and learning from other countries.
What if we don't see a second wave in the same way that we saw the first wave, but effectively just a long, low level of COVID deaths just carrying on for months and months as the disease works its way through the population and then sort of joins up with whatever winter flu crisis we would have anyway? I mean, do we need to be thinking about a different scenario rather than just another wave?
Well, I think the word wave has been, lots of ways you can interpret it. I think flare-ups or spikes are certainly a possibility, and there's a real fear that when winter comes that we will find ourselves in a very difficult position. I think what we don't want to do is continue to do the same as has been done and expect a different outcome. I think people are very frightened about that, with some justification. We want to prevent this from happening as well as to prepare for it. And the question is, what can a government and expertise bring to make sure that we have a better outcome than has been the case so far?
Dr. Godley, thank you very much indeed. Well, countries around the world with lowering infection rates have been easing out of lockdown, but stepping into the unknown has not been without risk. As we mentioned earlier, Germany has reimposed restrictions for the first time in one area where cases have risen. And there are fears of a so-called second wave in South Korea too. Our Foreign Affairs correspondent, Jonathan Rugman, reports.
All over Europe, the rules are being relaxed, the barriers coming down. This the scene at Madrid airport, families reuniting after Spain reopened its borders for the first time in months. More people returned to work yesterday after the state of emergency was lifted, but 1.5 meters of social distancing is still required in Spain, or masks worn if that's not possible. In France, all school children except sixth formers are supposed to be back now for the final fortnight of term, after a 1 metre distancing rule was deemed no longer compulsory. The French authorities want those who've fallen behind to go back over subjects they didn't understand during lockdown. Cinemas opened their doors in France yesterday, while museums began to reopen from the middle of May. Cinema goers here said keeping a 1 metre distance was a small price to pay for not having to watch another film at home, streamed online. In Germany, one county has gone back into lockdown for at least another week, with Red Cross workers in the city of Gütersloh undertaking door-to-door mass testing to help slow an outbreak which infected over 1,500 workers at a meat processing plant. So cinemas and bars are closing there, though the authorities are not yet calling this a so-called second wave.
So eine zweite Welle kann eben immer kommen.
A second wave can come, and theoretically it could come in Germany. But I'm very optimistic, because people here know that and continue to behave cautiously. And if we continue to ban large events, I'm optimistic we can prevent this second wave.
In South Korea, the audience for the world's only viewable production of Phantom of the Opera have been turned into phantoms themselves. Temperature checks and health questionnaires are de rigueur here, all the more so since the mayor of Seoul talked of a possible second wave following a cluster of cases linked to nightclubs and bars.
It might be okay for those younger generation and younger people, but they would be bringing back those diseases to their families, and which will affect their older elderly, their grandfather and grandmothers and grandparents.
Around 3 million Chinese in Beijing have been tested since an outbreak at a wholesale food market 12 days ago. Isolating the ill seems to be working, but passenger numbers on the Chinese capital's train network have fallen, a reminder that the road back to normal may not be straightforward.